Hi everyone, so for today's video we're going to talk about Kiro's story. Kiro. So Kiro is a 2-year-old male cat, and then he was a high-rise syndrome cat. So basically he fell off a tall building. Then high-rise syndrome is actually the phenomenon of animals falling off tall buildings. It happens in different cities around the world, including Singapore. So do you know that actually SPCA rescues an average of 5 cats a week which fall off tall buildings? Yeah, so actually that's quite a large sum of animals. It can be cats or dogs. Then for Kiro, unfortunately, due to the impact of the fall, he actually injured the roof of his mouth, which is called the palate. And then he had this condition called the acquired palate defect. And this usually happens when the chin hits the ground when he falls, so like hit like this. And then the impact actually splits the roof of the mouth open. Then what happens is that we actually needed to do surgery to fix his mouth. Alright, so let me briefly explain how the surgery will go. So the suture, you'll come in this way, go the other side, and then you tie a knot. So usually a key important thing to take note of is to make sure that the repair, the closure itself has minimal tension. Otherwise, if there's tension at both angles, but both sides pulling the suture apart, then it will increase the risk of repair failure. And then after the surgery, he needed a feeding tube. So the feeding tube is where we provide the daily nutrition requirement, and this is to minimize chewing and interference to the palate repair, so we can give the palate time to heal. We use an esophageal feeding tube for Kiro, which means the tube is connected straight to the esophagus from the side of the neck. Patients that have a palate repair are usually on a feeding tube for around 2 to 3 weeks. But for Kiro, he was actually on a feeding tube for almost 2 months. Because unfortunately, after the surgery, he suffered a serious episode of cat flu, also known as feline upper respiratory tract infection. So even though his palate defect has fully healed, he was still not feeling well and not eating at all. He was started on antibiotics and other medications, and he even started on transdermal mirtazapine, which is a type of appetite stimulant that's absorbed through the skin. Then while he is not eating, we provided his daily nutritional requirement via the feeding tube. But the weird thing is, despite medication for more than 1 month, he was still not recovering. We started to worry if there's another underlying condition that is affecting him. Because cats usually recover from cat flu within 2 weeks with medication in a home environment. So for Kiro, this is a cat that has not been eating by himself for more than 1 month at that point in time, and we just were unsure what was actually happening. We can't simply leave him with a feeding tube forever, and we honestly thought that he was not going to make it. So we tested him for FELV, FIV, because being positive for either of them could be the reason why his immune system is unable to recover from the cat flu. Thankfully, he was negative for both, so we decided to persevere with his treatment plan and continued the daily tube feeding. So this is a photo where he was still sickly and thin while we fed liquid diet by a syringe through his feeding tube. One of the most common complications of esophageal feeding tube is actually infection around the neck, and then unfortunately for Kiro, he did have an infection around the neck, and then we needed to do daily wound cleaning around the area under the chin as well due to his bad cat flu, and that was also part of the supportive care that we provided to prevent the infection from getting worse.
He's looking at the camera. I know. He's very sensitive in his mouth. Okay.
And thankfully, one day he ate by himself, so his appetite came back. And truly, there was a moment when we felt a big weight was lifted from our shoulders. So throughout his stay with us, most of the time he was just sleeping because he was so sick and tired. And then small little signs of him slowly recovering was when he started showing bursts of energy when we come into the room that he was in, and we found him actually on the higher platform, and then we noticed that he actually had more energy. He was able to jump a specific height, and then those were all little small good news for us. Kitty, come here slowly and see what this kitty is doing. Kitty? This was when we brought him back to the clinic for checkup, and then he is weighing 3 kg here. It's actually very good news for us at that point in time because previously his weight dropped to as low as 2.2 kg. Yeah, and then this is him when he was waiting in the cage, and as you can see, he's actually more active than compared to when he first came. Then as he was feeling better, we graduated him from his room, and then we allowed him to interact with our pets more. And the interesting thing was that he was able to get along well with both our cat and our dog. And after he fully recovered, he never left. So it has been 1 year since we brought him home, and he has become a dear part of our family. Kiro. Hello.